So I'm going to go here, show only the active speaker. All right. So our presentation is on advocating in favor of the rights of prisoners concerning organ transplantation. Group members Jaren Myrup, Emma Field, Caitlyn Slippey, and Nikolas Larsen. Let's go ahead. All right, so to give some background on this topic, organ transplant operations began around the 1950s. Prisoners were occasionally used as organ donors in the 60s and the 70s when the practice was still developing, but ethical concerns did surface later regarding coercion and whether or not prisoners can actually fully give a voluntary, unbiased consent as donors. This concern was due to potential for reduced sentences or other preferential treatment while still incarcerated. The debate continues today, but it centers on whether prisoners should have the same rights to donate or to receive organs despite the scarcity of organs. Supporters emphasize human rights and equal access to healthcare, through Kantian ethics. Critics, they tend to side more utilitarian, and they argue that organs should prioritize non-incarcerated individuals. Laws and policies vary across countries in the United States, reflecting ongoing ethical and legal debate.
Perfect. So as Jaren was saying, it kind of depends a lot on the country, on even the state, depending on the laws regarding organ donors and prisoners. So the World Medical Association kind of discourages prisoners from being allowed to donate or receive organ transplants. So that's kind of on a world level. As far as it's concerned, here in the United States of America, there's currently no federal laws regarding prisoner organ donations in the United States. Like I was saying earlier, it kind of depends a lot per state. The laws and kind of those restrictions vary a lot depending on what state that you're in. But here in Utah, the Utah Code 64-1344 states that prisoners, that prisons must give their inmates the option to be able to sign up to be an organ donor if they die while they're in custody. So that's kind of the law here in Utah, but like we were saying, it depends a lot. It depends a lot depending on what state you're in, kind of what the laws are. So you can go to the next slide.
All right, so as they were kind of saying, it's important to understand that laws and policies about organ transplantation for prisoners are not the same everywhere. Different countries, states, and even hospitals can approach the issue differently. A good legal example comes from the national study that surveyed 122 transplant centers across the United States. Researchers asked whether these hospitals would evaluate incarcerated individuals for organ transplants. The results showed that only about 49 centers were even willing to evaluate these prisoners, and an even fewer number, only 14 centers, said they would actually perform a transplant. But even then, it would still only be by a case-by-case basis sort of situation. Prisoners still have the right to medical care while they are incarcerated. This right comes from the 8th Amendment and a major Supreme Court case called Estelle versus Gamble in the 1976, where it was ruled that prisons cannot ignore serious medical needs of prisoners. So technically, prisoners should still have access to necessary medical treatment. However, this case study shows that in practice, there are still a couple of barriers that make it harder for incarcerated individuals to receive complex treatments like organ transplants. Because organs are such a limited medical resource, transplant centers often have to make a difficult decision about who gets access to them, and it begs the question of, even if prisoners have the right to healthcare, should that include access to highly limited treatments like organ transplants? And you can switch slide, sorry. And when we compare laws at different levels, we can see that governments handle prisoner organ donations in different ways depending on their legal system or ethical concerns. At a national level in the United States, prisoners still have the right to necessary medical care, which comes from that Supreme Court case that I mentioned earlier. Organ allocation itself is managed nationally through the Organ Procurement and Transplantation Network, as well as the United Network for Organ Sharing, which oversee how organs are distributed, making sure safety standards are upheld, and finding matching organ donors and acceptors for procedures. And then at the state level, like it was mentioned, the Utah Code 641344 allows prisoners to register as organ donors if they die while incarcerated. This means inmates can just voluntarily donate their organs after death, similar to those who are not in prison. Other states have created their own policies as well, so the rules can kind of vary on where someone is incarcerated at. States like Texas and South Carolina have opened the door a little bit, just like Utah, but other states like Nevada and Arizona specifically exclude this. So when we look at the bigger picture and internationally, the policies can be very different. For example, China has completely banned the use of organs from executed prisoners in 2015 because of ethical concerns about whether those donations were truly voluntary. And on the other hand, you have a country like the United Kingdom, which does allow prisoners to donate organs, but they do require strict safeguards to make sure inmates are not pressured or coerced into donating. And these differences show that countries around the world are still trying to balance medical need, fairness, and ethical concerns when it comes to organ transplantation and prisoners. And you can switch the slide. All right. So statistics help explain why this debate is so complex, because they show both the medical need for organs and the concerns about giving prisoners access to transplants. Our first statistics show the biggest factor of the organ shortage. So in the United States today, over 100,000 people are currently waiting for an organ transplant. That means thousands of patients and families are hoping that a matching organ becomes available in time. However, unfortunately, many people do not receive one in time. And according to the Organ Procurement and Transplantation Network, about 13 people in the United States die every day while waiting for an organ transplant. Because of this shortage, some experts do argue that expanding the number of potential donors, including prisoners, could help save a lot more lives. And research also suggests that many incarcerated individuals are open to the organ donation option. A study done by Anna Derzinski found that about 74% of incarcerated men supported organ donation or transplantation, which suggests a majority of prisoners are willing to participate in donation programs if given the opportunity. However, there also are statistics that raise some concerns and arguments against this idea. The study done by Aaron Faber, like I mentioned before, shows that only about 14 centers out of the studied 122 said they would perform a transplant depending on the situation. This shows that even when given the option for prisoners, there are many centers who would not even consider this to be a possibility in the first place. Another concern we can look at involves the cost side of this. For example, the average kidney transplant costs more than $400,000 in the first year, including the surgery and the follow-up care and any medication required. And since prisons are funded by taxpayers, some people question whether public money should be used for these procedures or not. And also, if we look at the medical concerns of this debate, prison populations tend to have a much higher disease like HIV and hepatitis rate, which can often complicate transplantation and long-term outcomes of the overall health of the organ that is being donated or transplanted. So statistics show that opening up the option to donate organs to a great number of the population could help fix the donor shortage a little bit, but at what expense? And you can switch the slide. All right, and then sometimes statistics and laws can feel a little distant compared to what's actually happening in real life. There is an example from Utah when the state passed the law allowing for incarcerated individuals to register as organ donors. After the law took effect, nearly 250 prisoners immediately signed up to become organ donors. This just shows that many incarcerated people are willing to contribute something positive and potentially even help save someone else's life. And organ donations can have an incredible immediate impact. Experts say that one organ donor can save up to 8 lives. And tissue donations can help as many as 50 people through procedures like skin grafts or cornea transplants and much more. So because of this, supporters believe that expanding the number of donors, including prisoners, could help reduce the organ shortage once again. And a story that developed here in Utah came from Lori Haglund of Salt Lake City, who says her son, Brock Butler, had a progressive liver disease. He died in September, a week before his 21st birthday, after spending 3 years on the waiting list for a liver. And many people began asking whether Brock might have had a better chance of receiving a life-saving transplant if incarcerated individuals had greater access to organ donation programs sooner. And there are also stories on the other side of this debate. Another example that happened in Utah in 2004 when a prisoner named Larry Van Pelt, he was serving a life sentence for murder, and he requested a kidney transplant that would have costed around $250,000. The request created a lot of public debate because the surgery would have been paid with taxpayer money. Many people question whether it's fair for someone serving a life sentence to receive such an expensive medical procedure when many law-abiding citizens were also waiting for transplants. Stories like this show why the debate is so complicated. While organ donations has the best power to save lives, people still disagree about how limited medical resources should be distributed and whether prisoners should be a part of that same bubble that those who are not in prison share. And you can switch the slide.
All right, let's go ahead and jump into some ethics theory. We're going to start with in favor of granting these rights to prisoners. If we take a look at categorical imperative deontology through Kant's formula of humanity, it states that people have intrinsic value and they should not be treated as a means to an end. This means that prisoners possess inherent worth despite incarceration, right? So they have value as human beings. They're not just reduced to, their sentence, their crimes, and their status as an incarcerated individual. Withholding ability to receive or donate organs reduces them to a means to cut costs or to administer additional punishment. When the state incarcerates an individual, they assume responsibility for that individual's well-being, which includes, as Nikolas stated, providing the life-saving care without discrimination. Excluding prisoners from transplant lists and consideration forces additional punishment on top of their already issued legal sentence, which absolutely cannot be justified under Kantian deontological principles. If we go on, we can look at some theories for against granting these rights. The ethical theory of utilitarianism, for example, states that choices should be made to do the greatest good for the greatest number of people. So due to the scarcity of organs, utilitarianism would prioritize non-incarcerated individuals because prioritizing prisoners could reduce widespread societal benefits from others who are still contributing to the community, potentially not receiving those life-saving organs. We have to approach from a utilitarian standpoint with some caution and care, however. Otherwise, prisoners with life sentences could be viewed as subjects simply for organ harvest instead of individuals with inherent worth. Looking at these two contrasting theories, it's easy to see that this is a very deep and a very complex topic with very heated opinions on both sides. Now, on one side, looking at things through a Kantian lens, we see that the prisoners are still people with inherent value and should be treated as such and should be given equal opportunity to those life-saving cares. And if we take a look at those who are against these organ transplantation rights, we see that providing prisoners with access to these very scarce, hard to procure life-saving measures, that are issued through these organ transplant procedures, that takes that ability to continue life away from somebody who may continue to contribute to the community.
Okay, perfect. So kind of like Jaren was saying, these are just some more of the key ethics principles. So there's the 4 key ethics principles, and So the people who are for the prisoners being able to donate and receive organ transplants, the ethics principle that it goes along with would be justice, which is basically fair or just behavior or treatment, to everyone regardless of their race, religion, economic status, anything like that. And so with this in mind, denying prisoners the right to donate and receive organs wouldn't really be aligned with that principle of justice. Those who are for the organ transplants for prisoners believe that they should be entitled to all of the same rights as just any other citizen. Just because they are incarcerated, that doesn't mean that they should lose their basic human rights. And those who are against it, the theory that would go along with is the autonomy, which is another one of the four key ethics principles. This encourages self-government and allows people to really make decisions based on their care, on their medical care, their actions, things like that, without having any sort of bias or any sort of pressure or bribery. People who follow this ethics principle, and those who are against this specific topic about the prisoners being able to donate and receive organs, believe that allowing the prisoners to donate or receive organs in order to, for some sort of reward to be able to shorten their sentence, or for other, briberies like that, kind of restricts them from being able to make a really informed decision, and therefore would be unethical. They believe that prisoners could feel pressure to do one thing or the other, which kind of would, like I said, restrict them from being able to make an informed, well thought out decision about something that's super important, right? Those who are incarcerated, and if they say, hey, you can shorten your life sentence, obviously they're going to donate a kidney. Does that make sense? And so there are those who believe super strongly this way that would not be ethical, and that takes away one's ability to make a decision, like an informed, correct, well thought out decision for themselves. You can switch the slide, Jaren. Thank you. So some other related ethics principles for the for side is proportionality, which deems that an action is acceptable if the good is greater than the bad that action could cause. So following this principle, denying prisoners the right to donate and receive organs wouldn't really be aligned with this principle, because allowing prisoners to be able to donate organs allows that there are more organs available for people who need them. So being able to harvest those organs from prisoners once they have died, or not as essential organs such as kidneys or other things like that. Being able to donate those organs, those prisoners would then be able to provide more organs for those who are in need of that life-saving medical treatment. And the other principle that would be against this topic is non-malfeasance, which promotes do no harm, right? So allowing prisoners to donate organs in order to shorten their sentence could harm them if they make that decision under pressure, kind of like the last one we were talking about. Making such a big decision under pressure, and they could end up regretting their decision later. And it could also giving those life-saving organs to prisoners who are in prison can therefore make it so that there can be other people, kind of like we've already talked about, other people who wouldn't be able to receive those life-saving organs in the chance that person would need it. So there's lots of different ethics principles that relate to both sides of this argument. And kind of like Nikolas and Jaren were saying, is that there's two very harsh extreme sides of this, and you can tie in a lot of these ethics principles in order to help prove or help disprove each of these sides of the argument.
Okay, so in conclusion, the argument in favor of allowing prisoners to donate or receive organs centers on the idea that incarceration does not erase a person's basic human rights. Access to healthcare, including life-saving treatments like an organ transplant would, should be based on medical need rather than a person's criminal history. Ethical principles such as autonomy and justice support the idea that individuals should have the right to make decisions about their own bodies and receive equal treatment within the healthcare system. Additionally, allowing voluntary organ donation from prisoners with strong protections against coercion, of course, could help address the ongoing shortages of organs and potentially saving more lives. From this perspective, denying prisoners access to transplantation risks turning healthcare into a system of moral judgment rather than medical care. In conclusion, on the other hand, the argument against allowing prisoners to donate and receive organs focuses on fairness and responsible allocation of scarce resources. Organs are extremely limited. Thousands of people die each year waiting for transplants, like we've gone over. And many believe that when life-saving resources are scarce, priority should go to individuals who have not committed serious crimes. There are also concerns about whether organ donation within prisons can ever truly be voluntary. The power dynamics and limitations of incarceration may create subtle pressure that makes fully informed consent difficult to guarantee. Kind of like what Emma was saying. From a utilitarian perspective, organ allocation should aim to create the greatest overall benefit for society, which some argue may justify prioritizing non-incarcerated individuals. Next slide. And then for the rebuttal, while the for side argues that prisoners should have equal rights and access to organ transplants based on human rights and medical need, this perspective may overlook the importance of fairness when distributing scarce resources. Even if prisoners retain healthcare rights, organ transplantation is not an unlimited treatment. It requires allocating organs that could save someone else's life. Additionally, the prison environment makes it difficult to guarantee that organ donation is truly voluntary. Even without explicit incentives, inmates may feel pressure to participate in hopes of receiving benefits or improved treatments or even a shorter sentence, better situation in the prisons themselves. Because of these concerns, some argue that limiting prisoner involvement in organ transplantation helps protect ethical standards and public trust in the transplant system. And then while the against side focuses on fairness and prioritizing law-abiding citizens, this argument raises ethical concerns about deciding who deserves medical care based on moral judgment. Organ transplant systems are designed to evaluate patients based on medical urgency and compatibility, not necessarily their past behavior. If criminal history becomes a deciding factor, it could create a slippery slope where healthcare access is influenced by social value judgments rather than medical need. And then it kind of just creates that environment for any medical necessary situation. Prisoners are still entitled to adequate healthcare under constitutional protections, of course, and denying them access to transplants solely because of their incarceration risks creating a discriminatory healthcare system. Next.
All right, so we're going to watch a short video. It's only a couple minutes long, but it goes into a little more of the details behind the rights that prisoners should have regarding their health care. It'll touch on the Supreme Court case that Nikolas mentioned with Estelle versus Gamble, and it'll dive into a few of those ethical principles that we've gone over as well.
I actually watched a good friend of mine that was not a life-term inmate who had a definite date to get out, turn green and die in his bunk.
Prison healthcare in the U.S. is broken. After serving their time, prisoners will almost certainly be sicker upon their release, if they even make it that long. Joseph Calderon was in prison for 17 years.
While serving time in the security housing unit, I had chest pain one night, 7 sharp pains that woke me up out of a dead sleep.
Joe wasn't able to see a doctor the night of his chest pain. It wasn't until 2 weeks later that he finally got to see one. Joe says the doctor told him he just had a muscle cramp and sent him back to his cell with Benadryl. While prisoners are the only Americans who are constitutionally guaranteed to have healthcare, they often have to fight to see doctors and get medicine. Okay, so why is prisoner healthcare so bad? When it comes to political power, prisoners rank pretty much at the bottom. In certain states, they can't even vote. And prisoners rank at the bottom of the social ladder, too. American society generally views people in prisons and jails as deserving of whatever mistreatment they get. There just isn't the political will to make prisons and jails more humane. And state and city governments are under tremendous pressure to make the cost of incarceration as low as possible. Low pay at facilities tends to attract less qualified doctors. Much of the medical care is outsourced to private contractors, who often rely heavily on unlicensed medical assistants instead of doctors. And it can take months to even see a doctor. One of those contractors, Southern Health Partners, only requires its doctors to spend 6 hours a week visiting jails. And one doctor may be responsible for thousands of inmates.
We see cases every day of the most horrific abuse and neglect of desperately sick people. A prisoner told to pay Tums for what turned out to be cancer. Nurses failing to deliver medications and falsifying records to show that they did. We have one case where a nurse wrote in the patient's chart that he had his vital signs were normal and he was in no apparent distress, despite the fact that the prisoner had actually died 10 hours earlier.
If they're lucky enough to get actual medical advice, prisoners might not be able to afford following it. They're still charged for copays and prescriptions. Their jobs in prison pay just pennies an hour.
The average pay scale is about 18 cents an hour. So $5 for your medications can start to add up.
Prisons and jails are designed to break people down. It's all but impossible to get meaningful care in a prison setting that is inherently detrimental to a person's physical and mental health. And stressful conditions, lack of exercise, and a diet full of salt, sugar, and carbohydrates don't do much to help sick inmates heal.
It's not unusual to see people who look 15, 20 years older than their chronological age.
So what do you think? It seems the real question isn't should prisoners get adequate health care, but how badly are we as a society willing to treat people in American prisons and jails?
All right, so while we can see that this wasn't directly related to the issue of organ transplantation, it casts a wider view on healthcare as a whole in prison systems. You know, it makes us think a little more deeply about the ethical principles that govern how we provide healthcare to incarcerated individuals.
Okay, so to end our presentation, we want you to think about whether your opinion changes depending on the circumstance. So the first one is a prisoner convicted of a nonviolent crime needs a transplant. So in this case, would your opinion change if the prisoner committed a nonviolent offense like fraud or drug possession and will eventually return to society? Some people might feel that the severity of the crime should matter when deciding access to scarce medical resources. Number two, a prisoner wants to donate an organ to their child. So what if an incarcerated parent wants to donate an organ to save their child's life? This scenario raises questions about autonomy, family rights, whether imprisonment should prevent someone from making medical decisions that could save a loved one who's not incarcerated. Number three, a prisoner serving life without parole needs a transplant. So would your view change if the prisoner will not be released back into society? Some people argue that limited organs should go to individuals who will eventually return to their communities, while others believe medical care should not depend on someone's future societal contribution. And then lastly, a prisoner wants to donate an organ to anyone on the waiting list. What if a prisoner voluntarily chooses to donate an organ to someone who's a stranger and they're waiting and they don't have any other options? This scenario raises questions about personal autonomy, the risk of coercion that we've kind of gone over in our presentation, especially in a prison environment, and whether allowing such donations could help address those organ shortages. These different situations highlight why this issue is ethically complicated. Many people find that their opinions shift depending on the circumstances, which show how difficult it can be to balance fairness, justice, and individual rights in healthcare decisions. So would you support or oppose transplantation in each situation, and why or why not?
All right, and that concludes our presentation. And